would say the same thing as I said before. In other words, do I want black people to have long prison sentences for using marijuana? No, I do not. It's like if they would simply treat black people in the same way that they treat white people who have small or larger quantities of marijuana, that would be great. But I'm speaking as a physician and as a psychiatrist who has seen the effect of chronic marijuana use. And marijuana in our textbooks in psychiatry and in medicine does alter functioning, such that I can look at people, look at their eyes, and tell how much marijuana they are smoking. And what I'm saying is that calling it medical marijuana is a trick that is being run on black people, because black people have high levels of unemployment and high levels of stress. That's different than the white population, where you might have white people who have jobs, they have income, and they are smoking marijuana. They are smoking it recreationally. They don't have the kind of stress that black people have. And so black people are under 24/7 stress from racism, white supremacy. So black people are treating the stress by continuing marijuana smoking. They're in a different ballpark and a different level of use. And it interferes with brain functioning. It affects memory. It affects people's ability to learn and to think coherently. And so I say that by saying medical marijuana is just saying to black people, it won't harm you. Now you're going to be in a Bantustan, removed from the urban centers with gentrification. You're not going to have employment. You will be frustrated, but you can have all the marijuana you want and all the marijuana cookies that you want and all the marijuana bread that you want to eat. You can just stay in a continuing state of being high because we don't have any use for you anymore. And we are bringing in some hard-working Hispanics, and so bye-bye Blackbird. Now, that's my position. And this Washington, D.C. is going to have Marley brand of marijuana. And that's, in my view, is another trick. Black people like Bob Marley's music. Oh, this is Marley's brand of marijuana. Oh, this is really what I want. Again, in the words of Neely Fuller Jr., if you don't understand white supremacy or racism, what it is and exactly how it works, everything else that you think you understand will only confuse you. I just recently saw an article about medical marijuana, and when people are tested to see if they have marijuana in their system for jobs, the employer doesn't care whether, well, this is medical marijuana that my doctor has given me. And the employer says, well, marijuana is marijuana. We don't want people with marijuana in their system working for our company. So I'm sorry, you don't get the job. Trick, 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 trick. One of the experiences that I had in first year of training doing a residency in general psychiatry many years ago, And I was in a training program at St. Elizabeth's Hospital, residency training program, and there may have been 2 black physicians training in psychiatry. And we were at St. Elizabeth's Hospital, and the psychoanalyst who was participating in this training session, he was interviewing a black male patient. It was a government hospital, a federal government hospital at that time, and they had white patients and black patients. And so the gentleman that was being interviewed by this white psychoanalyst, he might have been like a 32-year-old, 35-year-old black male. And so the psychiatrist went through the interview, and then he said to those of us who were in training, do any of you young doctors want to ask the patient a question? And so a couple of people asked questions, and I asked the question, how long had he been smoking marijuana? Now, this analyst didn't ask him anything about marijuana. And so the gentleman answered, like, 6 or 8 years or something like that. And so after the patient had left the room, the analyst said, how could you tell that he was smoking marijuana? I'd never met the patient before. And I said, because of the way his eyes look. And the patients that I see young black men who are psychotic, marijuana smoking, people who could complete college and their brains are all rattled because of marijuana and whatever anybody wants to put in it. I've had patients who smoke marijuana before coming to the office, and secondhand smoke. I mean, we're in a room in my, interviewing room, and the person has just recently smoked, and if they've smoked enough, I can get high, my head starts feeling hazy just because of what they're breathing into the room. Affecting my thinking with what's coming out of their lungs as they're talking for an hour. So, see again, Rivard, everything depends on, do we understand the situation that we are in? Do we have an in-depth understanding of the situation that we are in? We have 70% single-parent households. We have epidemic levels of male feminization. Every conceivable thing is happening to us. Blood pressure, high blood pressure, diabetes, cancer. And they call them health disparities. Yes, they're health disparities because we have a disparate. We don't have the financial resources that people who classify themselves as white have. We don't have the schools. We don't have the housing. We don't have other opportunities that they have.